The third part of the upper limb bones. In this lesson, we will explore the radius and ulna, the two bones of the forearm. These bones work together to allow movements such as supination and pronation while also providing structural support for the wrist and elbow joints. We will examine their anatomical features, key landmarks, and clinical significance. Let's get started with radius. Radius is a long bone located on the lateral or thumb side of the forearm. It works alongside the ulna to allow movements such as the supination and pronation of the forearm. Let's look at the anatomical structures. The first one is the proximal end. We start with the head of radius. It's a disc-shaped structure at the very top of the radius, and it articulates with capitulum of humerus, makes humeroradial joint, and also radial notch of the ulna. It makes proximal radio-ulnar joint. Then neck of the radius, a narrow region just below the head. It provides an attachment site for the annular ligament, which helps stabilize the radial head. Radial tuberosity here, or bicipital tuberosity, a rough projection below the neck on the medial side. If we say that the medial side, so here is the imaginary midline of our body. It serves as the attachment site for the biceps brachii tendon, enabling flexion at the elbow. Shaft of the radius, we can see the anterior border and medial or interosseous border. Interosseous border is a sharp medial edge where the interosseous membrane attaches here, connecting the radius and ulna. And the distal end near the wrist joint, there is a cytaloid process, is a pointed bony projection on the lateral side, and it serves as an attachment for the brachioradialis muscle and wrist ligaments. Then ulnar notch, a concave depression on the medial side of the distal radius. It articulates with the head of ulna, forming the distal radio-ulnar joint, because head of ulna is the distal end of the bone. This is the articular surface for carpals, a smooth concave surface at the bottom of the radius. It articulates with the scapuloid and lunate bones, forming the radiocarpal or wrist joint. Let's look at radius anteriorly. The first one is the head. Here makes an articulation with ulna, and then neck comes, radial tuberosity, cytolate process. And when we look at the posterior view of the distal end of radius, we can see the dorsal tubercle or Lister's tubercle here. It is a small bump on the posterior surface of the distal radius. It acts as a pulley for the extensor pollicis longus tendon, helping in thumb extension. What about clinical correlations? We can say Colles fracture, it's a distal radius fracture caused by falling on outstretched hand. It leads to a characteristic dorsal displacement of the wrist, forming a dinner fork deformity. And next, Smith's fracture. It's a fracture of the distal radius due to falling on flexed wrist. It results in volar displacement of the wrist. And also another clinic is the radial head dislocation, nursemaid elbow, we can say as well. It's a common injury in children caused by sudden pulling on the arm. The radial head here slips out of the annular ligament, leading to pain and restricted movement. What about the ulna? The ulna is a long bone located on the medial side of the forearm. It articulates with humerus at the elbow joint and radius at both the proximal and distal radio-ulnar joints. The ulna primarily provides stability to the forearm, while the radius is more involved in the movement. When we see the ulnar tuberosity, we can see easily it is the anterior view of the ulna, and then here is the lateral view of the ulna. We can start with the proximal end near the elbow joint. The first one is the olecranon process. It is a large curved bony projection forming the tip of the elbow. It provides attachment for the triceps brachiomuscle, allowing elbow extension, and also it fits into the olecranon fossa of the humerus during the full elbow extension. Please remember the olecranon fossa. It's on the posterior surface of the humerus, and olecranon process fits into the olecranon fossa of the humerus. Second, coronoid process. It's a triangular projection of the anterior surface of the ulna. It fits into the coronoid fossa of humerus during elbow flexion. It serves as an attachment site for the brachialis muscle, which helps in elbow flexion. Olecranon process here fits into the olecranon fossa on the posterior surface of the humerus. Coronoid process fits into the coronoid fossa of the humerus on the anterior surface of the humerus. Trochlear or semilunar notch here, a deep concave surface between olecranon and coronoid process. It articulates with the trochlea of the humerus, forming the humero-ulnar joint. It's the part of the elbow joint, we can say as well. Radial notch. It's a small lateral depression below the trochlear notch. It articulates with the head of radius, forming the proximal radio-ulnar joint. It allows forearm rotation. Rotation means supination and pronation. Radial notch. So head of the radius comes here and makes proximal radio-ulnar joint. Next, the shaft of ulna. We have here again the interosseous border, a sharp lateral ridge where the interosseous membrane attaches, connecting to ulna to the radius. The interosseous border is between the ulna and the radius. And the last one, distal end. The head of ulna is on the distal end, unlike the other bones. A small rounded structure located at the distal end of ulna. It articulates with the ulnar notch of the radius and makes the distal radio-ulnar joint. We have here a cytolate process like radius, a pointed bony projection on the medial side of the distal ulna. It provides attachment for the ulnar collateral ligament of the wrist. Clinical correlations. Monteggia fracture. Monteggia fracture is the ulnar shaft combined with radial head dislocation. It's usually caused by a fall on an outstretched hand with forced pronation. Next, ulnar cytolate fracture. It's often seen with Colles fracture. Remember radius clinics. It can lead to instability of the distal radio-ulnar joint and also ulnar nerve injury. We can say funny bone sensation as well. The ulnar nerve runs posterior to the medial epicondyle of the humerus, and compression or trauma to this area causes numbness and also tingling in the ring and pinky fingers. That's all for the radius and ulna. I hope this helped you understand the structure and function of these two key forearm bones. If you found this video useful, please like and subscribe for more anatomy lessons. Don't forget to leave a comment if you have any questions or suggestions for future topics. Thank you.